Urinary elimination. Normal elimination of urinary waste is a function that affects all body systems. Clients that have alterations in elimination may also suffer emotionally from body image changes. The kidneys remove waste from the blood and form urine. The nephron is the most functional unit of the kidney, and it is what helps form the urine. It's composed of glomerulus, Bowman's capsule, proximal convoluted tubule, the loop of Henle, the distal tubule, and the collecting duct. The ureters are tubular structures that transport urine from the kidneys to the urinary bladder. Urine that drains from the ureters to the bladder is considered to be sterile. The bladder is a hollow, distensible muscular organ that stores and excretes urine. It lies in the pelvic cavity behind the symphysis pubis. The urethra is where the urine travels from the bladder to be excreted through the urinary meatus. So it's the tube that goes from the bladder to actual elimination. When these muscles are contracted, it's possible to prevent urine flow through the urethra. These are a variety of urinary terms that you need to be familiar with. The brain structure influences bladder function, and that is done through the cerebral cortex, the thalamus, the hypothalamus, and the brainstem. Different factors that affect urination include pathological conditions that can be acute and reversible, and others that are chronic and irreversible. Different disease conditions are classified as pre-renal, where there's a decreased blood flow to and through the kidney, renal, which are disease conditions of the renal tissue or the kidney, or post-renal, which is an obstruction in the lower urinary tract that prevents urine flow from the kidneys. Specific diseases can include diabetes mellitus, multiple sclerosis, and benign prostatic hypertrophy, or BPH, Alzheimer's disease, Parkinson's disease, and degenerative joint disease. Socioeconomic factors also determine the degree of privacy that's needed for urination, and this can vary from client to client. Psychological factors include anxiety, emotional stress, and privacy issues. Fluid balances maintain the balance between retention and excretion of fluids. Dialysis is a procedure that is performed to help cleanse the blood of toxins that the kidneys normally do when the kidneys are no longer functioning appropriately. There's two different types of dialysis. We have peritoneal dialysis, which is an indirect method of cleaning the blood of waste products that uses osmosis and diffusion, with the peritoneum functioning as a semi-permeable membrane. And then we have hemodialysis, where a machine is used. It's equipped with that semi-permeable filtering membrane, and it removes accumulated waste products and excessive fluids from the blood. The processes of diffusion, osmosis, and ultrafiltration cleanse the client's blood. The blood will return through a vascular access device, and it's usually an arterial venous fistula or a hemodialysis catheter. So hemodialysis is going to use a machine that's going to filter the waste products using diffusion, osmosis, and filtration. The peritoneal uses osmosis and diffusion. Alterations in urinary elimination include urinary retention, and as urinary retention progresses, retention with overflow can develop. Bladder distension is apparent, and with retention, the client may void just very small amounts of urine 2 or 3 times an hour, but not experience real relief. Urinary incontinence can be temporary or permanent, or continuous or intermittent. It can affect any age of person, but it's very prevalent in the elderly or post-vaginal delivery women who spent an excessive amount of time straining as they were pushing the fetus through the birth canal. It causes problems with movement, removing clothing, mental incapacity, or can be problems with movement. You're not able to get your clothes off fast enough or get to the bathroom fast enough. With mental incapacity or muscle weakness as a result, again, of the vaginal delivery. Urinary tract infection, it's usually caused by E. coli. Bacteriuria is bacteria in the urine, and it leads to the spread of organisms into the kidneys and possibly to bacteremia, which is the bacteria in the bloodstream. Microorganisms commonly will enter the urinary tract through the ascending urethral route. Bacteria inhabits the distal urethra and external genitalia and vagina in women. So women are a lot more susceptible to infection because of the short urethra and close proximity to the anus. Burning during urination is known as dysuria, as urine passes through inflamed tissues. An irritated bladder is known as cystitis. Irritation to the bladder and urethral mucosa can cause hematuria, or blood in the urine. If infection spreads to the kidneys, pyelonephritis occurs, with symptoms of flank pain, tenderness, fever, and chills. Urinary diversions can be necessary because of trauma, cancer, radiation, fistula, or chronic cystitis. The types of diversion can include an ileal loop or conduit, a continent pouch, or nephrostomy. And just a little slide to help you with learning about UTIs. Infection control and hygiene can help prevent the spread of UTIs or the incidence of UTIs. Growth and development will help determine the client's ability to control the act of urination across the lifespan. Infants, children, and the elderly will experience problems with urination. The young need to learn to recognize the need to urinate, and the elderly need to deal with decreased functioning that accompanies aging. Muscle tone with weak abdominal and pelvic floor muscles, these can impair the ability of the urinary sphincter to maintain tone. Immobility, muscle damage during vaginal delivery, and/or muscle atrophy or trauma all help contribute to problems with urination. Psychosocial considerations such as body image, self-esteem, roles, and all can help influence urination. Gender differences can also occur. Males stand and females sit. A lot of males don't feel like they're able to urinate unless they're in a standing position. And cultural considerations. Cultural influences the act of urination. Urinary problems may not be treated in the Western tradition, and culture can also dictate how and when a client urinates. In some cultures, all clients will urinate in a squatting position versus a sitting position or a standing position. So when you're assessing the urinary function with the nursing process, you need that nursing history. What is the normal pattern of urination or symptoms of any alterations in their urinating pattern? Factors that can affect urination include environmental factors, medication history, psychological factors, muscle tone, fluid balance, current surgical or diagnostic procedures, and the presence of any diseases. Skin and mucous membranes, you have to always assess those for hydration. The kidneys. There may be some flank pain that occurs with infection or inflammation. Assess the bladder, as the distended bladder can rise above that symphysis pubis. And urethral meatus. Observe for any discharge, inflammation, and lesions. You also need to assess the urine. Assess intake and output. Assess the color of the urine. It should be a pale to straw or amber color. Urine is usually more concentrated in the morning, so be aware of that. And medications can change the color, and some foods such as beets, rhubarb, or blackberries. Dark amber urine can be the result of bilirubin from liver disease. We assess the clarity of the urine. It should be transparent unless pathology is present. You assess the odor. Ammonia is normal. If you have a sweet or fruity odor, that is usually indicative of diabetes mellitus or starvation. Different urine tests and diagnostic examinations can include the urinalysis. The specific gravity is the weight or degree of concentration of a substance. It is the weight or degree of concentration of a substance compared with an equal volume of water. A urine culture. It requires a sterile or clean voided urine sample. And it takes 24 to 48 hours to indicate the findings of any bacterial growth, and this is normal with any type of culture. After the culture is done, then they usually test for sensitivity to determine which antibiotic is going to be the most effective to kill that particular bacteria. Non-invasive examinations can include the KUB X-ray, a CT, or IVP or urodynamic testing. An invasive examination would be a cystoscope or arteriogram. To promote urination, you need to make sure that you're encouraging adequate fluid intake, especially water, and encourage urination with the urge, and make sure that you provide appropriate perineal care. Catheterization is the introduction of a tube into the urethra that goes all the way into the urinary bladder. They can cause UTIs, blockage, and trauma to the urethra. Catheters can be intermittent or indwelling, and you need to make sure that you're aware of your facility's policies and procedures regarding catheter care. To help prevent infection, it's necessary to maintain a closed system with the catheter system. Catheter irrigations and installations can be used to maintain the patency of an indwelling urinary catheter. But blood and pus or sediment can collect in the tubing and cause bladder distension and buildup of urine. Alternatives to urethral catheterizations include suprapubic catheterization, which is a surgical placement of a catheter through the abdominal wall just above the symphysis pubis that goes directly into the urinary bladder. Maintenance of the tubing in the bag will be the same as if they had an indwelling catheter. A condom catheter is used for male clients. It must be snug, but it should never be too tight.